All right, Dr. Emer, we are live.
All right, guys, we are doing 360 tightening today on our lady's leg. It's a supermodel leg lipo. We're doing internal heating right now with Renuvion. We already removed fat from her thighs because we're going to do a thigh lift, so all this skin is going to be removed. Right now, I'm doing the internal heating, so you could see the Renuvion. Look at this. Internally heating the skin. And I'm doing the tightening now after I've done the lipo. I don't want to do an aggressive lipo here because her skin will get looser, and so we did some lipo. There's not a ton of fat that was removed, probably a few hundred cc's, but in somebody thin, that's a good amount. And we're just using the Renuvion now internally, nice and slow. We get contraction off her legs. And to do this right, you guys, you have to do many passes slow. It takes a lot more time than people think, which is why I find a lot of doctors aren't getting the results or actually spending the time. You can see the smoke coming out of the ports. See how slim.
Someone wants a thigh lift, guys. Come see us.
Yeah, we're doing that today, you guys.
If you want to see some, stay tuned. We will actually go live for part of that later if you want to watch. And if you are interested for yourself in booking a consultation, you may send us a DM with your full name, phone number, and email, or you can email us at appointments@jasonemermd.com and give us 24 to 48 hours. We will get back to you.
See this, guys? It's really important. You go really meticulous. We do every section, multiple passes. And you could feel the power of it.
What is her pain going to be like after the surgery from this?
A little bit of pain because we're going to do the thigh lift, but it's actually not bad. Our aftercare with our hyperbaric and our oxygen and our IVs, people feel fine within days. Almost all my patients don't take any pills. Last pass. Almost every one of them, Tylenol and ibuprofen, that's it.
So Dr. Emer, do you have any procedure for the D area, defining like liposuction around that area?
Yeah, of course, we do the mons pubis. It's all over my internet. Go ahead and look that up. We do all this lower area all the time. We can do that easily. Just DM us for a consult. Now you may need a thigh lift, or you may need a mons pubis lift. That's a different story. It's like a mini tuck we posted yesterday, but we need to see you to know.
No, this is not a mannequin. This is a real patient.
You guys see the tightening, the degree of tightening in here. I'm just freeing up the area.
How long until she can resume normal exercise?
2 to 3 weeks. Usually about 3 weeks or so. And then again, the idea is we're tightening everything below, but we're going to pull from above and get her more improvement. It's not perfect. It's not a exact full thigh lift, but it's better than nothing. Otherwise, the lipo alone will make her looser.
One of our patients asking, do you do calf implants? I will fly from the UK to you.
I don't do implants. I do fat grafting, though. If you have fat, we can use fat, no problem. I'd love to do it. You can see on my Instagram and my YouTube a lot of videos of calf fat. And then lastly, I'm going to do one more pass on the knee. This area is like a critical area for women. Get it as tight as we can. But I would love for you to come from the UK. We have lots of clients from there. I would start, my opinion is always to start with fat and then add the implant. So if you want to do that, email appointments@jasonemermd.com. All right, that leg is great. And so we always then push out some of that fluid. You can see the gas is coming out. And then our goal now is we're gonna lift this area. So now on this side, we're gonna do the same thing. Hold on. A little scissor there. Open up the port slightly. Perfect. Great. And we're gonna do that same thing over here. Work nice and slow. Lift everything up. And we're going to continue heating. So what questions are they asking about Renuvion or supermodel leg lipo?
We're getting tons of reactions, not as much questions, a lot of reactions out of this.
So yeah, if you guys want information, definitely contact us. And then, you know, we do so many slim patients, so many patients that have lost a lot of weight.
Lots of loose skin.
Exactly, with looser skin or trying to contour, want athletic builds. My work is more conservative. It's less overdone. I like to do things that are gonna make you be able to keep the results forever.
Also lots of revisions as well.
Exactly. This is a revision case, actually. I didn't
And
say that, but
another patient asking, how far out are you booked for consultations and surgeries?
consults, we can always fit you in. Surgeries are going to be more difficult, so you definitely need to consult us. If it's something I can add, I'll add. It may be a little bit of time, it may not. We just have to consult with you. So DM us right away, appointments@jasonemermd.com. Our social team will reply to you and get you an appointment within 24 to 48 hours. Just make sure to DM.
Yeah, send us a DM. We do need your full name, email, and phone.
But it's very important for legs that a meticulous combination approach is done. Otherwise, you're not going to get the same outcome.
And yes, guys, our patient is asleep. They're not feeling any of this right now.
You guys can see. Going through every area, tightening it up. And you can literally hear it.
Get close for them. Let's get
Oops, sorry guys.
sound clip.
Okay, go ahead and listen. So that's it.
Can you show our viewers some Renuvion with the scissors?
Sure. Hold on. I'll show you guys. Renuvion conducts heat with a plasma flame. So you can see there's the flame internally. That's tightening the skin. And under the skin it has many webs, many finger webs. So that constricts the tissue and improves the cellulite.
Okay, the person I was asking about a consultation earlier is saying, I once had lipo done somewhere and they said they couldn't take much out because they were afraid of it creating saggy skin. How is yours different?
Well, that's the point, guys. We're doing internal heating and we're doing a thigh lift. So that's what's different. We don't just do lipo alone, we do both to help prevent that. That's That's why you gotta consult with us. You may not be the best candidate for lipo. You may need a lift or tightening, which is what we're doing today.
All right, guys. Thank you for being with us.
All right, I'll see you guys soon.